Let's start with some examples of drugs act on sympathetic nervous system. Today we will discuss on those drugs act on autonomic nervous system. Let's jump into the
Hello
video.
dear student, last class I have discussed about autonomic nervous system, which is a part of our nervous system, because from today we will start the drugs acting on different organs or different system of the body. First we will start with drugs acting on autonomous nervous system or autonomic nervous system. Last class, to see what is autonomic nervous system, what is their physiological function and what they generally do in our body, and what are the main receptors which are helping in ANS to do different drugs, their action. All about ANS and autonomic nervous system I have discussed already in previous video. Go and check it out before going to the today's video, which is based on the drugs acting on autonomic nervous system. So in autonomic nervous system, that are the special classification of drugs which that is the drugs which generally acts on autonomic nervous system by binding with different receptors and show their specific action. So now the drugs can be act same as like autonomic nervous system. That means they will do the same function what is done by ANS or autonomic nervous system. Or some drugs are there, they can act against the autonomic nervous system. That means they will do the opposite work that generally ANS did with our body. So all the drugs will do against the autonomic nervous system. Now the drugs what that will work for ANS or autonomic nervous system, or the drugs that will do or show their action against the autonomic nervous system, based on their action, that drugs are classified into two parts or two classes or two classified based on their action. The first one is the drug which act on sympathetic nervous system and work the or action same like sympathetic nervous system. All that drugs are called sympathomimetics drug. And the drugs which generally work against sympathetic nervous system, that means do the action opposite of sympathetic nervous system action, that drugs are called sympatholytics drug. Now if the drugs which we are using is acting on parasympathetic nervous system and it is doing the same work that like of parasympathetic nervous system, then that drugs are called parasympathomimetics. And if the drugs which are doing action opposite of PNS or against parasympathetic nervous system, all that drugs generally called parasympatholytics drug. Today we will going to discuss about sympathomimetics drugs which generally act on sympathetic nervous system and do same work as done by the sympathetic nervous system in our body, that I am going to start to explain in next slide. So today I am going to discuss on the drugs which act as autonomic nervous system. Specifically you can tell that act as sympathetic nervous system action, that drugs are called sympathomimetics. Now from that name only you can understand. First, from sympathomimetics, sympatho it seems to be mean sympathetic nervous system which is a part of ANS or autonomic nervous system. And by the name only you can understand mimetics. Mimetics comes from a word called mimic, and you know mimic means to copy someone's action. So here sympathomimetics are the drugs which are generally copy the action of sympathetic nervous system of autonomic nervous system in our body. All that drugs are called sympathomimetics. So what are sympathomimetics? Sympathomimetics are the drugs which generally copy or follow the same action as done by sympathetic nervous system in our body by binding with different sympathetic nervous system which generally act as sympathetic nervous system. I told you in previous classes they generally told as adrenergic receptors. They can be alpha, beta. In alpha also 1 2 is there, beta 1 2 3, and their specific site are also there, that I have already discussed in the previous video. Go and check it out. So sympathomimetics are the drugs which generally copy or mimics the action of sympathetic nervous system in our body by binding with different adrenergic receptors like alpha, beta, and their subtypes. So I have finished up the definition of sympathomimetics drug. Now we have to start studying about the different classification of sympathomimetics based on different basis. So first we will study about the classification of sympathomimetic drugs based on their mechanism of action. So first type based on mechanism of action is direct acting sympathomimetics drugs. So how the drugs generally do their action based on them, they are called as direct sympathomimetics drug. In this the drugs will generally work as sympathetic nervous system and mimic their action, means they will do same function as of sympathetic nervous system by directly binding with different adrenergic receptor, that can be alpha, that can be beta, or that can be their subtypes also. Now the classification I told you, that is direct sympathomimetics. Under that examples are epinephrine, which generally act directly by binding with alpha 1, alpha 2, beta 1 and beta 2 adrenergic receptors. Again another example is norepinephrine. They generally show their action by directly binding with alpha 1, alpha 2 and beta 1 receptor. So these are the example of directly acting sympathomimetics based on mechanism of action. The second classification of that same based on class, that is class 2 or indirect sympathomimetics drug. So here sympathomimetics drug, they will not directly bind with different adrenergic receptor, they will show their action by improving or increases the release of norepinephrine or noradrenaline, or they can show their action by decreasing the reuptake of norepinephrine. So in first class I told you, in direct acting sympathomimetics they will show their action by directly bind with adrenergic receptor alpha, beta and their subtypes. But in case of indirect sympathomimetics, they will show their mechanism of action by increasing the release of or secretion of norepinephrine, or by decreasing the reuptake of norepinephrine from our body. Example is codeine. How they generally act as sympathomimetics? They generally show their action by decreasing the reuptake of norepinephrine. So this is the classification based on mechanism of action of sympathomimetic drugs. Now we will discuss about the classification of sympathomimetic drugs based on their affinity or based on their action which is based on their specific receptors. That means here we will classify the sympathomimetics based on how that sympathomimetic drug is doing their work by binding with specific receptor. It can be bind with alpha, or can be bind with beta, or can be bind with their subtypes, or they can be bind with both alpha and beta. Based on that we will do that classification. First one is alpha 1 specific. That sympathomimetic drugs will show their action by binding with alpha 1 adrenergic receptor. Example is phenylephrine. The second classification of that is alpha 2 selective sympathomimetics. By the name only you can understand they will show their action by directly binding with alpha 2 adrenergic receptors. Example is methyl dopa. The third one classification is beta 1 selective. By the name also you can understand that drugs will act directly by binding with beta 1 receptor like dobutamine. Next classification is beta 2 specific. By the name also you can understand that drug will show their action by binding directly with beta 2 adrenergic receptors. Example is salbutamol. Now the last classification of that is non-selective or beta non-selective. That means they can bind with both B1 and B2 or beta 1 and beta 2. Based on that they are called as beta non-selective sympathomimetics. The example is isofrontinol. So these are the classification based on the affinity of the sympathomimetic drugs towards a specific receptor. It can be alpha or alpha 1 alpha 2, or it can be beta 1 or beta 1 beta 2, or it can be beta 1 and beta 2 both. Based on that they are classified into alpha 1 selective, alpha 2 selective, beta 1 selective, beta 2 selective, and beta non-selective sympathomimetic drugs. So by that I have finished off the classification of sympathomimetic drugs. Next topic of that sympathomimetic drug is physiological action. Physiological action. That physiological action about sympathetic nervous system and parasympathetic nervous system I already have discussed into the previous video. To understand their action on different organs like gastric, CVS or cardiac vascular system, or on kidney, or on eyes, or on different other system, endocrine system, male genital, all that physiological action about sympathetic nervous system and parasympathetic nervous system I already have discussed into the previous video. Please go through that video to understand the physiological action of sympathetic nervous system and parasympathetic nervous system to betterly understand the physiological action of sympathomimetics drug. After physiological action, you have to know about their clinical uses or therapeutic effect or therapeutic uses of different drugs that generally act as sympathomimetics in our daily life. First one is to treat asthma. We all know sympathetic nervous system generally dilates the bronchial muscle. So by sympathomimetic, by dilating bronchial muscle, it can treat asthma. Example you can use as salbutamol. So salbutamol is a beta selective sympathomimetics which generally dilate bronchial muscle and helps to treat asthma. Then you can use sympathomimetic to treat cardiac arrest. cardiac arrest or heart attack. The example is epinephrine. Then you can use sympathomimetic drugs in clinical trials as to treat shock or hypotension. Hypotension means low BP, or can treat shock. Example is dopamine. Okay, then you can use sympathomimetic drug as local anesthetics. Anesthetic is used before the surgery to make the patient consciousness so that he or she can't feel the pain during the surgery. Example is epinephrine. So by that I have tell you some examples of sympathomimetics and about their clinical therapeutic effect to treat different diseases like asthma, cardiac arrest, hypotension or shock, and local as a local anesthetic and their example. Now we will discuss about the different adverse effects of sympathomimetic drugs. Adverse effect or adverse drug reaction. I have already discussed about what are adverse reaction, their types, and all these things, how they can cause, how we can treat all these things. You can also go through adverse drug reaction from my previous video that I have already discussed into our YouTube channel. So now we'll tell about different adverse drug reactions which are non unwanted, undesirable, toxic in nature. All that adverse drug reaction caused by sympathomimetics we will discuss now. First one is tachycardia. This is due to the increased heart rate, because we know in cardiovascular system, sympathetic nervous system generally increases the heart rate. So tachycardia can be a adverse drug reaction due to the overuse or overaccumulation of sympathomimetic drugs into our body. The others are restlessness, anxiety, insomnia, means no sleep urge, means you can't sleep or you will not get sleep. Then you can tell urinary retention, that means less amount of urine excretion and is started to accumulate in our body. And some contraindicated adverse drug reactions are also there, which can be caused by over accumulation or overuse of sympathomimetic drug. That comes under contraindicated adverse drug reactions. The example of contraindicated adverse drug reaction caused by the over accumulation or overuse of sympathomimetics is hypertension, which is called as high BP. It can be due to the increased heart rate or increased blood volume or increase the blood pressure. It can cause hypertension as contraindicated adverse drug reaction, or it can cause diabetes. What is diabetes? Diabetes means increased glucose or sugar level in blood is called as diabetes. So these are the adverse drug reaction that can be caused by the over accumulation or overuse of sympathomimetic drugs. So by this I have finished of the sympathomimetic chapter. So in sympathomimetics today's chapter we have discussed about different drugs, act on ANS, their classification, and specially we discussed in that video about sympathomimetics drug, what are their classification, what are their classification based on mechanism of action, and what is their classification according to the or based on the affinity towards a specific receptor. Then we have discussed about physiological action that you can study from the previous year or previous videos. There you can understand betterly. Then we have discussed about the different therapeutic usage and clinical uses, like to treat asthma, to treat shock, to treat different disease condition, that we have discussed into the clinical usage of sympathomimetic drug. And at last we have discussed about different adverse drug reactions that can be caused by the over accumulation of sympathomimetic drugs, like tachycardia, bradycardia, then insomnia, anxiety, restlessness, and different contraindicated adverse drug reactions also, like hypertension, diabetes, etc. In the upcoming classes, I will be discussing on sympatholytic drugs, which generally act against sympathetic nervous system. So go through that sympathomimetic drug, and I am requesting you to go through adverse drug reactions and the video of introduction about autonomic nervous system. All that 2 videos link is already given into the description. Please go through it, then go through that sympathomimetic drug to better understand the concepts. Thank you.